Consider you've got some tissues and you get an infection and the white blood cells move in to fight the infection. You are antioxidant deficient. And you get this infection in your throat or your urinary tract or somewhere. And the white blood cells come in and your immune system's strong enough, they kill the infection. But when they release free radicals, they're shooting these free radicals like chemical bullets, sort of willy-nilly. They're also going to hit your own tissues. And when they hit your own tissues, they're going to damage your own tissues unless your tissues have bulletproof vests. And your body's bulletproof vests for its own tissues are antioxidants. And if there's a depletion of antioxidants, the free radicals will damage the body's own tissues if you don't have enough bulletproof vests. And so what happens is when you damage the body's own tissues, some of those cells are destroyed and you get cellular debris, which causes more white blood cells to come in, which causes more chemical bullets. They scoff up the debris, but they leave in their wake more antioxidant depletion because they're releasing more free radicals, depleting whatever antioxidants you can get there, and causing more tissue debris. You get a vicious cycle and you never get over the quote infection. And that's something we call pseudo-infection syndrome, which we're going to talk about a little while later on. We've just talked about it. We'll review it again in a little bit. And so what happens is you get tissues, whether it be an infectious source like I just talked about or an injury, and the free radicals that come in actually create even more tissue damage and prolong the healing process, whatever it might be. So you sprain an ankle, and some people's sprained ankles, they're playing in their sport again in a week, and other people are limping around 3 weeks later. And sometimes that's because of the free radical pathology. It is not inactivated by the appropriate antioxidants. And so the free radicals that are released when the tissues are being scavenged, the tissue debris is being scavenged by our white blood cells, by our phagocytes, and the chemicals that are released are creating more tissue debris in that process, creating more tissue debris, creating more white blood cells, creating more tissue debris, creating more white blood cells. It just continues. And when you have these other factors, such as food allergies, chemical sensitivities, heavy metal toxicity, a stress exhaustion stage, you're not enough corticosteroids, immune system upregulation, fatty acid imbalance, antioxidant depletion, more tissue damage, you get this vicious cycle of inflammation and pain going around and around and around like this. And this is what we see in some of the most difficult patients. Whether these patients be patients who sprain their ankle and a month later are still limping and have swelling, or whether it be a patient with autoimmune disease, has Crohn's disease or multiple sclerosis or scleroderma or whatever. These are the processes that take place. Well, you see we've addressed pretty much all these processes in the course that we're talking about. But when you put them in perspective like this, it kind of gives an overview to realize that this is how the body can sometimes not recover from injury and have a vicious cycle of pain and inflammation.